My name's Jennifer Alspach. I'm going to be doing my assessment today in my house here. We are in quarantine, so I'm not able to use a clinical site at this time. So I'm going to show you my ID and then scan the room. Scan the room here. Okay, and then again, this is my husband, and we both have been quarantining together, and so we are both not wearing masks or gloves just because we don't have access to them at this time, and he has agreed to that he's okay with that. So, move on with our assessment. Hello, I'm going to wash my hands at this time. So my hands are being washed. My name is Jennifer. I'm a nurse practitioner student at Northern Kentucky University, and I'm going to be doing a full body assessment today. Can you tell me your name and date of birth?
Yes, it's Graham Alspach, and my date of birth is 8/21/1997.
Perfect. Okay, I'm just going to ask you a few questions, and then we're going to get some vital signs started on you, okay? So you told me your name and your birthday. Can you tell me where you are right now?
Yes, in my house.
Perfect. And what year is it?
2020.
And who's the president?
Donald Trump.
And why are you here today?
For an assessment.
Perfect. Okay, so he is alert and oriented ×4, so that's how I would document that. So we're going to move on to his vital signs. So I'm going to go ahead and get a temperature on him. Underneath your tongue, and this has been cleaned before use. All right, he's 97.8 degrees Fahrenheit, so that is appropriate within normal range. So I'm going to just stick this on your arm here. Turn my thermometer off. Just relax your arm for me there. Perfect. Your blood pressure is 148/100. Do you have high blood pressure?
No, not that I know of.
That's a little elevated for us today. He doesn't have a history of that. Must be nervous for me. So I'm going to move on here, and I'm going to use my second hand on my thing here to just check your pulse. All right, and your pulse is about 84. Okay, I'm just going to go ahead and just check one more thing here. So I'm going to have you go like this. Just check it one more time. Okay, he's breathing about 16 times a minute. I do that because if you tell the patient, then they sometimes will know to hold their breath or breathe a little bit faster. So that's why we do that. Thank you. Okay, so I'm going to go ahead and move on to my assessment. So I first start and I look and see that he is well kept and he does not appear to be in any kind of distress. That was the across the room assessment that I started with. I see that his skin is pink and appropriate for his ethnicity and doesn't appear to have any kind of open wounds or anything at this time. So I'm going to move on to the skin assessment. So I see again that he is pink, doesn't appear to have any kind of open wounds or abrasions or lacerations, any concerning bleeding at this time. So I'm going to move on to palpation. So I'm just going to feel your skin. He is wearing a shirt just because that is more appropriate than him being shirtless at this time. So we are going to palpate here. So I'm just going to feel your skin here. I feel it is warm and it is dry. I don't see any cracking or any kind of lesions or any, it's not wet at all. So no abnormal findings with that. So we're going to move on to the next assessment, and I'm going to have you follow a couple commands for me. So I'm going to have you open your eyes real big and close them tight and smile and then frown and puff out your cheeks. So he is able to follow all those commands. Perfect. So your cranial nerve number 7 is intact. So I look at his head, and it is appropriate for his size of person. So I would call that normocephalic. I see that everything within his face is symmetrical and all is even. So I don't see any abnormal findings just looking. So next I'm going to move on to his scalp. So I see that I'm going to look here He's a little bit too tall for me, so thank you. So I'm gonna just look here on the sides of his head. He does have shorter hair, so it's easier to see, but in his haircut here, it's a little bit longer, so I just have to move the hair around and just inspect for any infestations, any lesions, any abnormal findings, which I do not see anything there. So you can look up. Thank you. And his skin is appropriate and pink on his hair as well, or in his scalp as well. So next I'm going to palpate. You tell me if you feel any kind of discomfort. I'm going to state, I'll ask you at the end. So what I'm feeling for is any indentations, any bumps, any lumps, any abnormal findings, and then as well as tenderness. So I do not feel any of those things on his hair or on his head. I mean, do you feel any tenderness when I do that?
Nope.
Perfect. Okay, so the next thing I'm going to go on to his TMJ here, this joint. So I'm going to have you open your mouth and close your mouth and kind of put your jaw out like that and in. Okay, and then so for that I was feeling for any creaking, crepitus, any cracking, popping. Did you feel any of that? Any tenderness as well?
Nope.
Okay, perfect. So his cranial nerve number 7 is intact. So next I'm going to move on to his head, ears, nose, throat assessment, ears and eyes, nose, throat assessment. So next I'm going to move on to his ears. So I'm just going to look at them. They are symmetrical on his face, and on inspection, I don't see any kind of edema or redness. So now I'm going to move on to palpation. So what I'm going to do, I'm going to kind of pull them out here and just kind of palpate all around. Do you have any tenderness when you do that?
No.
Okay, so there's no tenderness. They are normal with no lesions, no heat or any of those findings. So because of that, I know that there is likely not an outer ear infection, so it is okay to look inside of my ophthalmoscope. So I'm going to turn this on. I'm going to just look into it. Thank you. I'm going to look in here. And I don't see any excess cerumen. I see that his tympanic membrane is white and pearly, and I don't see any signs of infection on that ear. So we're going to move on to the other one, and because he's an adult, I pull his ear up and back. And I look in the same thing here, and I see no abnormal findings on this side as well. No extra cerumen, and no, the tympanic membrane is white and pearly. So next we're going to check the whisper test. So we're going to just assess his hearing. So what I'm going to do is I'm going to whisper a couple words to you, and you repeat them back to me. Okay, so I'm going to put this ear over here.
Brown wall.
Perfect.
White wall.
Perfect. Okay, so that shows me that cranial nerve number 8 is intact. So what I'm going to do next, I'm going to move on to his eye assessment. So initially I look at him and I see that his sclera is white, his irises are green, and his pupils are appropriately sized for the situation at this time. So I'm going to move on to his conjunctiva, and I'm going to pull his eyes down like this. Look up for me. Sorry, thank you. And I see that there are no abnormal discolorations. It's shiny, it's pink, and that is an appropriate finding. So next we are going to move on. I'll have you stay right there. I'm going to move back about 6 feet here, right where the laptop is here. So this right here, I'm going to check your visual acuity. So tell me the smallest line. We're about 6 feet back with a small eye chart. Show me the smallest line you can read.
LTFPH.
Okay, now close your right eye and do the same thing.
LTFPH.
And close your left eye and do the same thing.
LTFPH.
Perfect. And so that shows me that he is able to read 20/20. So at 20 feet, he is able to read what the normal eye is able to read at 20 feet as well. So what we're going to do next, I'm going to just change my light here so I can look in. Maybe. There we go. Turn on here. Okay. From our review of systems assessment, I know that he does not wear glasses and has 20/20 vision, and I have contacts in as well, so I'm able to see at 20/20 at this time, so I'm going to keep this at a 0 and assess his eyes. So just look forward for me. Perfect, so I'm going to look in. Perfect, and I see that his optic disc is appropriate, and I see red and orange around it, and I don't see any abnormal findings. So I'm going to do the same on this side. Perfect, and I see the same on this side as well. So what I'm going to do next, I'm going to just dim the lights here Fortunately, I do have that window over there, so it's kind of hard to have it all the way dark. But I'm just going to check for reactivity in his pupil. So again, look straight for me right there. Just look at the wall. And I'm going to just check to see for constriction. Perfect, and they do constrict, which is great, as appropriate. Okay, I'm going to turn this back on. Okay, so what I'm going to have you do now, I'm going to have you follow this. Just watch this all the way in. And so I'm looking for any kind of vibrations or abnormal findings with his gaze on the pin light, which is all appropriate. So next what we're going to do, I'll have you stand here just so they can see. Unfortunately, he's a little bit taller than me, so I'm going to turn here. So close this eye here, and I'm going to have you stare right at my eye. And what I'm going to do is I'm going to hold up a number, and you tell me what it is.
2, 3.
Okay, perfect. Now I'll do the same eye over here.
3, 4.
Okay, perfect. Okay, you can go ahead and take a seat. Next, what we're going to check is the 6 cardinal fields of gaze. So we're going to have you follow this pin light again, okay? So just follow this. We're looking to see, again, if there's any vibrations or abnormal findings with the way his eyes are following this pin light. And so far, his optic exam is unremarkable, and that means that cranial nerves 2, 3, 4, and 6 are all intact. So we're going to move on to the nose assessment. So again, I look and see that his nose is appropriately placed on his face. It is triangular, does not appear to have any kind of deformities. I'm going to just now palpate it. You tell me if there's any tenderness.
Nope.
Perfect. Okay, so I'm going to look inside, and I don't see any kind of obstruction or any abnormal findings there. So I will have you plug one side. Take a big deep breath. Okay, and do the other side as well. Perfect. And is there any difficulty breathing with that?
Nope.
Okay, perfect. So now what I'm going to do is I'm going to have you close your eyes. Okay, and I want you to tell me what the smell is.
Coffee.
Okay, that is perfect. That is cranial nerve number 1, which is intact. So what I'm going to check now is just your sinuses. So tell me your frontal sinuses here. Do you have any tenderness on palpation?
No.
Okay, and your maxillary sinuses?
No.
Okay, and going back to the ear assessment, the Weber and Rhine test, I don't have the tuning fork because Amazon was sold out and I can't do this in a, not sold out, but on back order. So I don't have a clinical assessment. So just so you know, what I would have done is for the tuning fork, I would cause a vibration with the bell kind of at the end, and I would have put it right here on his forehead or maybe on his teeth. Whenever he tells me the vibration stops, or he would tell me where the vibration is at. So that's what I was assessed for the Weber test. And for the Rhine test, what I would do is I would do the same thing, the vibration, and I would place the end of it on his mastoid bone back here. And then whenever he would hear that, I would switch it over and have the vibration of the bell next to his ear. And so what that checks for is to see the air conductivity versus the bone conductivity, and the air should be longer. So that's what I would have assessed for. But again, I don't have that tool with me today. So next, I move on to the mouth assessment. So I look and I see that there's no cracking at his lips. It's not overly moist. It's not overly dry. So I will have you open up your mouth for me. And I'm just going to look in with my pin light here for the lack of better lighting. And I see that the top of his tongue is rough and it's pink. I don't see any kind of patches or white spots at all. I see his buccal mucosa is intact and it is shiny. Put your tongue at the top of your mouth for me. Perfect. And I see that the bottom of his tongue is also pink and shiny. You want to look here just to make sure, because a lot of mouth cancers start at the bottom of the tongue. So you want to make sure you watch for that in your assessment. So again, open your mouth for me. And I don't see any kind of dental decays or cavities. I do see that his fillings are all appear to be intact. Do you have any tenderness in your mouth at all?
No.
Okay. So next, again, I would be wearing gloves if I had some at the house, but I do not. He said before that that was fine with him. So I'm going to have you open up your mouth, and I'm just going to look in here. Okay, perfect. And I'm going to look at his uvula. Say ah. Okay, next I'm going to unfortunately check for the gag reflex here. So, okay, I'm so sorry. So that is intact. So stick out your tongue for me, side to side. Okay, perfect. So all that activity is appropriate for him. And I note that his voice is appropriate and not hoarse at all. So that shows me that cranial nerves 9, 10, and 12 are all within and intact, within limits and are intact. So next I will move on to his lymph node assessment. So I check here, tell me if there's any tenderness, but I'm checking to see if I feel any swelling for lymph nodes and his preauricular, subauricular, anterior and posterior cervical, which I don't feel any abnormal findings, the tonsillar, and then of course I would like for his shirt to be off, but I would feel here underneath his subclavicular as well. So I don't feel any abnormal findings there. So I'm going to move on to his thyroid. So I'm also doing, this also is within the 9, 10, and 12. I'm going to have you swallow this water here. Let me check for, okay, perfect. So I see that his thyroid is appropriate. His trachea is midline and is freely mobile when he speaks and when he swallows. So I next, can I stand here just because I don't have a small chair, turn the other way, and I'm just going to assess his thyroid. So the best way to do this is from the posterior way. Thank you. So I don't feel any swelling, any goiter, abnormal findings there. You can take a seat here again. Okay, so what I'm going to do after that is I'm going to listen for his carotid arteries and just make sure I don't hear any kind of bruise or abnormal findings. I'm just going to listen here. And I do not hear any bruise or abnormal findings. So next I'm going to just look and see if his jugular veins are distended, which they are not. It is all appropriate. And everything in his neck appears intact and within normal limits. So next I'm going to move down to his chest. If he was not wearing a shirt, I would be looking kind of at his skin there as well, which he's told me prior that it is all intact and there's no concerns. So I'm going to just look here and inspect, which everything in his chest wall looks appropriate. So now I'm going to palpate. So I'm just going to kind of palpate everywhere, look for any crepitus or abnormal findings. And then we're going to the back as well, which again, if I didn't have a table, I would be directly behind him more in an appropriate manner. And so I did not see any abnormal findings on palpation. Was there any tenderness with palpation?
No.
Perfect. Okay, so next what I'm going to do, I'm going to check for tactile primitus. So I'm going to have you repeat the words 99.
99, 99, 99, 99, 99.
Okay, perfect. And can I have you, I might actually have you sit in this chair here. Sorry. I make this assessment a little bit easier at this point. Okay, so we're going to do the same thing.
99, 99, 99, 99.
Okay, perfect. Okay, and at this point, I'm going to go ahead and just listen to the lungs. Although the lobe sizes are different, you still want to make sure you check in all 8 places, posterior and anteriorly. Take a big deep breath. And again. And again. And again. Again. Perfect. And I hear no adventitious sounds, no crackles, no wheezes, and he has told me before that he does not have any kind of lung disease. So that is appropriate findings, and we're going to do the same. Breathe. Deep breath. Oops, sorry, do that one. It's kind of under your armpit here, sorry. Big deep breath. Perfect. Okay, so as I was looking earlier, again, all his lung sounds are appropriate and no adventitious sounds. So now I'm going to look for the point of maximal impulse. So I'm going to go mid-clavicular on the 5th intercostal space here and just feel for appropriate findings, which I do. It's nice and appropriate. So I'm going to go ahead and listen as I inspected his chest wall and palpated earlier the whole wall, and he said there was no tenderness. So now I'm just going to go ahead and just listen to all of his heart sounds here. And it is strongest at the PMI, and S1 and S2 are intact, and I don't hear any gallops or murmurs at all. Okay, so next I'll have you hop back up here. Sorry. Move this chair out of the way. So next I'm going to have you lay back. We're going to proceed with the abdominal assessment. Thank you. Okay. So next I'm going to just look at his abdomen. If he didn't have the shirt on, I would make sure that it is all appropriate there. There we go. So I don't see any kind of masses, lumps, obvious hernia, nothing like that. Everything is an appropriate finding. So next I will go ahead and auscultate, because you want to do that in the abdomen before you palpate, since you are going to be doing a deep palpation. So I'm going to just listen in all 4 quadrants as well as the epigastric area. And his bowel sounds so far are active. And his bowel sounds are definitely active. This epigastric area is active as well, and it's appropriate, and I don't hear any kind of bruits or adventitious sounds there as well. So next I'm going to do some deep palpation. Definitely want to make sure you check McBurney's point and make sure that there's no abnormal findings there, because you want to assess for tenderness everywhere. Is there any tenderness on assessment?
No.
Okay, and I don't feel his spleen or liver enlarged. I don't feel any other abnormal findings. You can sit back up. Thank you very much. Again, the breast and GU assessments are skipped in this area. I would be checking for lumps, bumps, masses, and any abnormal findings there as well on a normal assessment. So next we're going to move on to the musculoskeletal assessment. So we're going to start with the shoulders here. So what I'm going to have you do is I'm going to have you shrug up and down. And I'll have you turn against my hand and turn against this hand. We're going to go up and down. Perfect. So that right there checks for cranial nerve number 11, which is also intact. So what we're going to do next is I'm going to check range of motion and basically all of his limbs here. So I'll have you stand up again. And what you're going to do, I'll have you face me. I'll have you go all the way up. Perfect. And all the way down and back behind you. Back. Perfect. So that is great. Any pain or discomfort there?
No.
Okay. And now you're going to put your arms down like this and go all the way up and all the way down. Any pain or discomfort there?
No.
Okay, perfect. So what you're going to do next, I'm going to have you just kind of flex like this and extend down. Perfect. And you're going to do the same thing against my resistance. So try to flex. Perfect. Ooh, he's strong. And then back down. So push. Perfect. Okay, so his range of motion in his shoulders is appropriate. I am going to skip the hands now just because he's standing up. And so I'm going to have you bend down and check your spinal and hip flexibility there. Perfect. Okay, great. Any pain or tenderness with that?
No.
Okay, I'm going to have you hold your hips still and only turn your upper half. Just check the flexibility of the spine. Perfect. Any pain or tenderness?
No.
Okay, so I will have you now take your knee and flex it and extend it. Any pain or tenderness?
No.
Do the same on the other side. Okay, perfect. Okay, so now I'm going to have you flex against my hand. And then pull. Perfect. And then same on the other side. Flex. And then send.
Sorry.
Yes, okay. There you go. Okay, now take a seat here. So we're going to just check the range of motion in your hands now that you're sitting. So I will have you go like this for me and then kind of flip them over. Perfect. Okay, so now in this kind of position here, what I'm going to have you do is just kind of flex your wrists and then bring them up, in, and out. Perfect. Any tenderness?
No.
Okay, so now with only your fingers, just bring them down and then bring them back up and then out and then make a fist. Okay, I'm going to check your strength as well. So grasp my fingers here. Perfect. And you want to make real tight? There you go. Perfect. And you want to make sure you use 2 fingers. That way the patient is not able to grab hold of your hands and hurt them. That is all perfect findings. So now I'm going to have you put it down again. We're going to just check for hip flexibility. So I'm going to have you bring this left leg all the way up as high as you can. Perfect. And all the way down. And you're going to go all the way out as far as you can. And in. Perfect. So now I'm going to just bring this hip up. So bend your knee. Okay. Any tenderness there?
Nope.
We're going to go in and out. Any tenderness?
No.
Okay, perfect. Bring your leg up against against my hand. Now pull against my hand. Okay, now push out against my hand. Perfect, and in. Perfect. Okay, now the right leg. I'm going to do the same thing. So go all the way up, right, and all the way down. Perfect, and we're going to go out and in. We're going to bend up that hip again. We're going to go out and in. Perfect. Okay, and back down. And again, you're going to go against my hand here and down against my hand. out against my hand, and in. Any pain or tenderness with any of those joints?
No.
Okay, you can sit back up. There you go. Down here. So we're just going to check his feet as well. So can you kind of flex your feet towards you, push down like you're pressing on gas, put your toes together like this, and out. Any pain or tenderness?
No.
Okay, so I'm going to have you pull against my hand and push on the pedal. There you go. Pull against my hand and push like on the pedal. Perfect. So his strength and range of motion is all appropriate there. So next we're going to move on to sensation. So what I'm going to do, I have this little stick that I broke here. So I just want to show you that this right here is going to be sharp, and this is going to be dull. Okay, can you tell the difference?
Yeah.
Okay, perfect. So what I'm going to do, I'm going to move down here. So I want you to close your eyes for me, and just tell me sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Perfect. Okay, so his sensation is all intact there. Next, I'm going to just check his pulses. So I'm going to check his radial pulse here. And that's good to check them at the same time so you can check for equality. And they're both, I would document them as 2+. They're nice and strong, not overly bounding, and not inappropriate either. And his brachial pulses are again nice and strong, not bounding or irregular or weak or thready. So we're going to move on to the dorsalis pedis. And so we're going to move here. And his dorsalis pedis is nice and strong as well, and it's normal and appropriate, not weak or thready. And then the tibialis, we're going to go ahead and check here. And it is appropriate. So next, what I'm going to have you do, so neurologically, I'm going to have you, you answered my questions appropriately with your name, date, and time. So now I'm going to have you do a little exam. So what we're going to do, I have a marker over here, and this is my blank sheet of paper and then a clipboard just so he doesn't write on my table. And this is just a sticker that came on the clipboard. So what I'm going to have you do, there it is. So what I'm going to have you do, I'm going to have you draw a big circle on this blank sheet of paper for me. Oh, before we start that, I'm going to tell you 3 words, okay? Okay. So red ball truck. Okay. Okay, can you repeat those words? Red ball truck. Okay, perfect. Now I'm going to have you write a circle or draw a big circle for me. Okay, and I want you to number it like you would for a clock. Okay. Okay, and make that clock say 10 past 11 or 11:10. Perfect, so that is appropriate. Now, before I had you draw this clock, I had you say 3 words, and I told you 3 words. Do you remember what those words are? Red ball truck. Perfect, so his mini cog is appropriate. He drew a clock saying 10 past 11. So the last part of this assessment, the neurological exam, I'm going to check his deep tendon reflexes. So we're going to go brachioradialis here on both sides. I'm going to have you just kind of relax and maybe try to shut your eyes for me, okay? So just check that. Perfect. Next side here, just nice and relaxed. Brachioradialis is intact, and for your brachial muscle, what we're going to do, you're going to feel that tendon. Just try to relax your arm for me. And the main part is you're going to look for this muscle here, not necessarily the reflexes going on here. Okay, perfect. There is a nice contraction there. Oops, that's my ear. All right, so his brachial pulse or brachial reflex is intact. So I'm going to have you just kind of relax, like push on me like you would a table. So this arm is nice and relaxed. There you go. Okay, that is perfect. I saw the contraction of his tricep there. And then same, so lean on me like a table. Let me make sure this arm is nice and Okay, that's great. So next we're going to move on to the patellar reflex. So you're going to feel this tendon here. Okay, perfect. And then the other side. Okay, saw that contraction there. So next I'm going to just place a little pressure back here and check for his Achilles tendon. And I felt the pressure go back down on my hand. So same thing here, just light pressure and then the Achilles tendon. And that is all appropriate. So that concludes our full head to toe assessment. I did the review of systems with him prior to this. And do you have any questions for me?
Nope.
Okay, so thank you for being my guinea pig and letting me do my assessment on you. So I appreciate it, even though we're in these quarantine circumstances. So thank you so much.